transfusion of brain.
So he's stuck in and all as well. Crisis returning a patient like 2 crisis.
We've been waiting here for like 5 minutes now, and they're not here yet.
Typical. Wow.
Hi, my name's Christy. I'm going to be your nurse today. And this is Marissa.
Hi, I'm going to be your second nurse today.
Hi.
It looks like your name is Alex.
Yes, my name's Alex.
Okay, and your last name?
It's Kwok,
Okay, and how do you spell that?
Kwak,
Okay, and what is your birthday?
1/1977.
Okay, perfect.
Perfect. All right, and what brought you to the clinic today?
Well, my wife and I, first of all, this is my wife, Dawn.
Hi.
A couple weeks ago, we went in to give blood, and a few days ago, I got a letter from the Red Cross saying that I was infected with hepatitis C. And I was just wondering, like, what exactly is that?
So hepatitis C, it's a virus that affects the liver. Once infected with the virus, your body tries to kill off the infected cells by launching an immune response to the liver, which then causes inflammation. And in doing so, that inflammation damages your liver.
Okay, so I knew hepatitis had to do with the liver, but it's a virus and causes inflammation in the liver?
I don't feel sick. How come I don't have any symptoms?
Alex, when a person first becomes infected with hepatitis C, they usually don't show any symptoms or signs for several years. You have to have extensive damage to your liver before you can start to see signs and symptoms of the disease. So people who have hepatitis C don't know they have it for a very long time.
So what signs and symptoms do we need to look out for?
A lot of the symptoms are going to be flu-like symptoms, which may throw you off. They include anxiety, aches and pains, weight loss, poor concentration, nausea and vomiting. Some of the symptoms that you should really watch out for, and call us if you need to, are going to include jaundice, which is yellowing of the skin, dark urine, and clay or gray colored stools. If you experience any of these signs and symptoms, you should call your healthcare provider, like I mentioned earlier.
But how did I get it? I exercise, I try to do everything right, just a little confused.
There are many ways to get infected with Hep C. The most common ways are sharing needles with someone who possibly has it. You could have had a blood transfusion, or even having sex with other men is a possible way of getting it.
Well, I've never done drugs. I've never had a blood transfusion that I can remember, and the only person I've been with is my precious Dawn. We met in high school, and I instantly knew that she was the one for me. Could I maybe have gotten it from my wife?
It's possible, but the chances are pretty low. Basically, the virus is transmitted person to person by blood contact. So let's say if you were to share a razor with someone who has it, and there's a little bit of blood left over on the razor, then you could get it.
Oh, I understand now. You know, I could have gotten it from Uncle Buck. You know, he keeps coming over and he's using my razor all the time, and I
Yeah.
bet you that's how I got it.
Well, honey, didn't you get a tattoo like 6 months ago?
Oh, that's right. Maybe that's how I got it.
Maybe.
How can I How can I keep my wife from getting it? Like, I really don't want her to get sick.
Well, the use of condoms can reduce the chances of her, Dawn, acquiring, but there's no guarantee.
Well, what happens now? Like, how do I keep my liver healthy? Is there anything I can do?
Now you'll need to discuss with your doctor treatment strategies. There are a large number of antiviral medications you can take to slow down the progression of your disease. Your doctor will be able to determine which medications are best for you. You should also be vaccinated against hepatitis A and hepatitis B.
And it is important that you know that there's a chance that this can clear up. And there's also a chance that it can become a chronic disease and you can have it for your lifetime. From the information that we have, it looks like 20% of people clear up from hepatitis C because they resolve it on their own. And 80% of people go out and develop chronic hepatitis C, and there's no cure for that. But there's treatment and other measures that you can take to be your healthiest. You can do things like eating a well-balanced diet, getting plenty of rest. You can also avoid drugs and alcohol, as this kind of substances only increases the workload on your liver that's already under stress of the hepatitis C.
Ah,
Very
okay.
important.
Mm-hmm.
You know, I think I can do that. We could probably do that, right?
Oh, yeah.
But let me just make sure I got this right. So I could maybe eat healthier, maybe do some exercise, just so that my body's healthy. And what was the second one? We could go see a doctor and try to get some medication to treat my disease. Is that correct?
Yeah, that's great. If you do all those things, that should definitely help increase your health.
So Alex and Don, do you guys have any other questions?
I think you covered everything. Do you have any questions, sweetie?
Not right now. No.
No?
Okay, well, what I'm gonna do right now is I'm gonna send you home with some information for you and your wife, which covers a lot of what we talked about today, as well as some additional resources that you can use if you have any other questions. Like we said earlier, you can always call us, and if any symptoms appear that are worrisome to you, you have to make sure you call us, okay?
Please do.
Okay.
Okay, sounds good.